will now focus on the anatomy of the posterior part of the trunk. The muscles of the posterior trunk can be divided into 3 layers based on the plane passing through the transverse processes. In this way, we identify an anterior layer mainly composed of the iliopsoas muscle. An immediate layer aligned with the transverse process and primarily including the quadrus lumbrum, and finally a posterior layer, which we will be discussing here, that contains the paraspinal muscles. The paraspinal muscles have a complex anatomy and varied nomenclature with numerous anatomical variants. I have chosen to present their anatomical distribution according to the Winkler's model, which includes 3 superimposed layers. These muscles mainly serve to erect and stabilize the spine. Let's start with the deeper layer. According to Winkler, the deep layer can be divided into 3 muscle groups. First, the unisegmental muscles, the intertransversali, and the interspinals, which are very difficult to visualize with ultrasound. The second muscle group includes the spinotransverse group, mainly represented by the multifidus muscle. This muscle has a craniocaudal orientation. It originates broadly from the sacrum and inserts up into the base of the second cervical vertebra. The third group includes the erector spinae muscles, also known as the transversospinalis group. These primarily include 2 muscles, the longissimus medially and the iliocostalis laterally. Both muscles share a common origin via a broad tendinous sheet attached to the multifidus ischium and the medial portion of the iliac crest. They then extend proximally toward the cervical region and separate into 2 distinct muscle bellies. The longissimus is a thick, wide muscular band located behind the multifidus. It stretches from the common tendinous origin up to about the 2nd rib posteriorly. It also sends bundles towards the transverse process of the thoracic and lumbar vertebrae, as well as the lower margins of the ribs. The iliocostalis lies lateral to the longissimus and extends from the thick tendinous lamina to the 3rd cervical vertebra. Along its path, it gives rise to the bundles extended to the costiform process of the lumbar vertebrae, the posterior arch of the first 10 ribs, and also from the transverse process of the 5 cervical vertebrae to the first 6 ribs. Deep muscles are enclosed within a non-distensible fibrous sheath, which corresponds to the posterior layer of the thoracolumbar fascia. This sheath also contributes to the spinal stabilization. The intermediate layer includes 2 muscles, the serratus posterior superior and the serratus posterior inferior. These are quadrangular, very thin muscles and thus barely visible on the ultrasound. The serratus posterior superior originates from the spinous process of C7 to T3, runs downward and laterally, and inserts onto the superior borders of ribs 2 through 5. The serratus posterior inferior originates from the lower borders of the last 4 ribs, with the fibers running upward and laterally to insert on the transverse process of T12 to L3. In this section, I will show you how we can use ultrasound to visualize the different anatomical structures we've just discussed. First, we will examine the deep layer at the thoracic and lumbar levels, and then move on to the superficial muscles, rhomboids, trapezius, and latissimus dorsi. Let's begin with the deep layer of the thoracic level. At an axial view at the level of the spinous process, you can see the multifidus muscle covering the posterior thoracic wall. Superficial to the transverse process and the underlying distal fibers of the trapezius. If I shift the probe laterally, we encounter the spinal erector group, with the longissimus medially and the thinner iliocostalis more laterally. Below that, we can see the cortical outline of a rib. Switching to a sagittal view, we see successive ribs separated by the intercostal muscles. Beneath these, we may observe pleural movement under the lower rib margins, and in febrile cases, we can see a small pulsating artery corresponding to the intercostal neurovascular bundle. Now, as I shift the probe back medially over the ribs, we first encounter the iliocostalis and then the longissimus, and then the distal part of the trapezius. Moving closer to the midline, we see interwoven fibers corresponding to the multifidus muscle bundles. Deepest of all, we identify the spinous process and the interspinous ligament. A slight probe shift reveals the laminae, shaped like a horse's head, and lateral to them, the ribs. Now let's look deep at the muscle layer at the lumbar level. First, in an axial view at the level of the spinous process, we can identify the bony landmarks, the spinous process deeper and more lateral, the transverse process under the multifidus and the facet joint. You can clearly see the joint space and deeper the transverse process. Between the spinous process and the posterior joint mass lies the multifidus muscle. Moving laterally, we observe a fatty plane that separates the multifidus from the erector spinae muscles. Immediately lateral to the multifidus lies the longissimus. More laterally, separated by an aponeurosis stemming from the erector spinae, we find the iliocostalis. Superficial to both muscles is a broad aponeurosis, which corresponds to both the rowan aponeurosis and the posterior layer of the thoracolumbar fascia. Now, in a sagittal view along the midline, we see the spinous process and the interspinous ligament. Sliding the probe laterally reveals the laminae, again shaped like horse heads, over which lie the different multifidus bundles. Further lateral still, we observe the joint masses, rounded and sometimes described as resembling camel humps, over which fibers of both the multifidus and the longissimus intermingle. Moving further laterally again, we reach the transverse process, beneath which the fibers of the iliocostalis and the longissimus intermingle. If I move very deep at the level of the sacrum, we see the sacral slope. Here, the muscles giving rise to the broad aponeurosis muscular insertion is the multifidus alone.